It's interesting that a portion of the modern chiropractic profession still embraces old philosophies, because the profession was founded by people who wanted to change. The founders were free thinkers looking into the future for something better, and oddly enough, many current chiropractors romanticize the past by clinging to old philosophies and practices, while simultaneously idolizing the founders of chiropractic who didn't want to cling to old philosophies and practices. Welcome to Build Beyond, a podcast designed to challenge and guide you on your health journey so that you can meet your full potential. As a chiropractor who hosts my own podcast, I haven't spoken much about chiropractic adjustments, and there's a reason for that. I believe that adjusting is safe and that it can be effective for managing things like pain, numbness, and tingling. Adjusting can also help increase movement, and it can help manage some kinds of headaches. These are all great things, and I believe that the chiropractic adjustment is a valuable tool. Unfortunately, not everyone will benefit from getting adjusted. And even if chiropractic adjustments do help, the effects are only temporary. Beyond short-term relief, there doesn't appear to be much value in joint manipulation, and that's okay. It's still a good tool. So rather than discussing a tool that only offers the potential for short-term benefits, I've focused on elements of pain management and health that offer more significant and universal effects, like general physical activity, strength training, cardio, nutrition, sleep, and mental health. These elements are important for pain and health management, and they offer opportunities to self-manage without the need for a healthcare provider to do something to you. This makes them superior to chiropractic adjustments, in my opinion. But during this episode, I'm going to deviate from my plan. I'm going to talk about chiropractic adjustments. I'm not necessarily recording this episode for other chiropractors, although chiropractors are more than welcome to listen. I'm recording this to help patients understand the benefits and the limitations of getting their backs cracked. I'll also give my opinion on what chiropractors can offer besides hands-on therapy. In general, I think the benefits of adjusting tend to be exaggerated, which is a shame because it's misleading. Chiropractic has placed joint manipulation up on a really tall pedestal, and in over 125 years, we haven't been able to justify this glorification. Historically, chiropractors have tied their identities to adjusting, and because we've doubled down on the supposed benefits of manual therapy for so long, a portion of the profession seems obligated to defend the chiropractic adjustment at all costs, which is also a shame because chiropractic has so much more to offer than just back cracking. So let's review the original theory used to explain the effects of the chiropractic adjustment. The traditional philosophy behind chiropractic suggests that routine spinal adjustments prevent pain. This philosophy also suggests that chiropractic spinal adjustments improve overall health. Chiropractic was traditionally based on the belief that spinal misalignments cause disease. So you have a bone that's shifted out of place and it negatively affects the nervous system, which then ultimately affects the bodily function and then results in disease. This philosophy is known as chiropractic subluxation theory, which claims that when a chiropractor adjusts specific spinal segments, the nerves at those levels work better, causing the downstream organs to function better and then improving overall health while preventing pain. If you've ever been to a chiropractic office, many DCs display posters that depict nerves originating at specific spinal segments and then running to specific organs. These posters are pretty common in chiropractic clinics, and they illustrate the traditional concept of subluxation theory. Some chiropractors have even equated receiving routine spinal adjustments to being as effective and as essential as routine dental care. Now, this theory sounds logical, but is this actually how the human body works? Subluxation theory originated in the late 1800s, and based on the limited info available at that time, this concept was justifiable. But this philosophy doesn't appear to be supported by a body of current scientific evidence, which doesn't necessarily mean it's false. We still don't know very much about the human body, and just because something isn't currently accepted by science doesn't mean it's not real or true. So I don't want people to get offended or closed down by my opinions. If you're going to continue listening, which I hope you do, I'm going to ask that you keep an open mind. I will support my opinions with evidence, and I'll list all of my sources in the description. Here are some issues with this chiropractic philosophy. Generally, spinal segments don't spontaneously shift out of alignment unless there is trauma or pathology. Now, I understand that the spine can feel like a bone has shifted out of place, but sensations don't always represent what's actually happening in the body. Icy hot is a great example. It feels like the tube contains lotion that's both hot and cold, but we know that it doesn't. The interesting thing is that many chiropractors continue to use this outdated terminology even though they agree that the spine doesn't slip out of alignment. But why does that matter? This explanation, although well-meaning, can contribute to disability if a person is in pain and believes that they need to be realigned to get out of pain. These words can create a false sense of dependency. If a spinal segment were to actually shift out of place and someone could then reposition it with their hands, that would suggest that the spine is unstable. That's a trip to the emergency department in an ambulance because it's a medical emergency. If our spines were fragile enough to casually slip out of alignment while sleeping, for example, then every stumble or fall would probably result in a spinal cord injury. We're just more robust than that. But what happens if you're in pain and you see misalignments on x-rays? If you get some imaging and it looks like your spine is out of alignment, there are a few things that could be happening. If it looks like one part of your spine has majorly shifted compared to another part, and there was no trauma or pathology, it probably took a long time to get that way. I don't know of any evidence that supports the idea that we can change the positioning with our hands. And again, if we could reposition spinal segments with our hands, that would probably be an emergency. Now, if you see a slightly twisted or tilted segment, that could be normal. Most people don't have textbook-looking joints, and your spine is designed to twist and tilt while remaining stable and not affecting your nerves. Again, we are more robust than that. Imaging findings, for example, x-rays and MRI, are also poorly correlated with pain. If we x-rayed 1,000 people with no spine pain, we would find things on the images that you would assume should cause pain. Likewise, if we x-rayed 1,000 people with spine pain, many would have no significant findings. Their joints would look normal. Now, I'm not saying that imaging is useless because it can be invaluable if it's used appropriately, especially for medical interventions. But in the absence of things like trauma or pathology or 10 out of 10 pain, imaging people to look for the source of their pain may not be necessary. And imaging people to look for misalignments and then suggesting that those misalignments are the root cause of their pain and other health issues may be a big stretch. There are guidelines for the appropriate use of imaging. For example, we use imaging if there's trauma or if we're concerned about fractures or tears or instability of the spine. We definitely need imaging if someone is experiencing weakness that's getting worse, like foot drop. There are many reasons to order imaging, and almost all of them are related to the possibility that the patient may need to see a medical physician for some reason. So, is the bone out of place concept useless? No. Sometimes people have structural problems like severe scoliosis, where spinal alignment can affect the function of the nervous system. Also, as I mentioned before, trauma can cause misalignments of the spine. Some people have pathologies like tumors or osteoporosis that affect spinal alignment and clearly contribute to symptoms. But these patients need medical care, not chiropractic care, at least initially. So I'm not saying that these people would never benefit from chiropractic care. Chiropractors just wouldn't be realigning their spines to fix their problems. It's also important to understand that chiropractors can't agree on what should be considered spinal dysfunction. How do we really know when a spine isn't moving well? So let's talk about a more modern definition of the chiropractic subluxation. I got this updated definition from a continuing education course. This course is from Palmer College of Chiropractic, and I'll link the course in the description. According to the presenter, the current model of subluxation was developed through a consensus. The interesting thing is that chiropractic has been around for over 125 years, and we still haven't proven that chiropractic subluxations exist. In fact, the body of evidence to support the existence of a chiropractic subluxation is so weak that many chiropractors don't believe that it exists. If the explanation for pain and disease is so simple, why do we still rely on consensus and not hard data? According to the consensus statement, we currently define a chiropractic subluxation as a self-perpetuating, central segmental motor control problem that involves a joint, such as a vertebral motion segment, that is not moving appropriately, resulting in ongoing maladaptive neuroplastic changes that interfere with the central nervous system's ability to self-regulate, self-organize, adapt, repair, and heal. That's a mouthful. This consensus definition of subluxation is interesting, but it may be a little difficult to understand. So let me break it down. It's important to point out that this definition completely abandons the bone out of place and the correcting spinal alignment narrative, probably because there's little to no evidence to support it. So, if a chiropractor tells you that your spine is out of alignment, that doesn't even fit the modern definition of a chiropractic subluxation. This updated definition essentially claims that if the spine isn't moving well, the poor quality movement will result in ongoing changes in both the brain and the spinal cord that will ultimately interfere with the body's ability to function properly. The full consensus statement also admits that this model is subject to change with new scientific findings, so modifications to the definition are anticipated. However, they believe that this model reflects what is currently known. After learning this new definition, I have a big question. How do chiropractors accurately and repeatedly assess whether or not the spine is moving appropriately? It appears that chiropractic subluxations are identified by signs and symptoms, such as pain, stiffness, and then loss of range of motion. Subluxations are then considered to be corrected when a patient is adjusted, and then these signs and symptoms improve. According to the presenter of the continuing education course from Palmer College, one reason why chiropractors and other healthcare professionals can't agree on this subject is that chiropractors have struggled to identify subluxations reliably. The reliability of evidence for finding subluxations varies depending on whether pain is part of the assessment or not. That's interesting. Okay, let's review the most common methods that chiropractors use to locate subluxations. Again, this info comes from the subluxation course provided by Palmer College. Pain provocation is the most reliable way to know where to adjust because when chiropractors poke people and they wince and say, ow, it's easy to agree on the location that hurts. Therefore, many chiropractors believe that pain provocation offers the most favorable reliability for identifying subluxations. But if chiropractors poke someone and it hurts, does that necessarily mean that there are ongoing changes in the brain and the spinal cord that interfere with the central nervous system's ability to self-regulate, self-organize, adapt, repair, and heal? That seems like a big assumption. Stiffness palpation is another common way for chiropractors to find subluxations. But if we remove pain from the equation, identifying stiffness is unreliable. A chiropractor can attempt to identify stiffness with passive joint play assessments. So the patient would be still while the chiropractor creates movement at joints and then determines if that movement seems unusual. Now, this relies on the chiropractor determining if the joint feels abnormal. But for example, if a chiropractor has never assessed a joint prior to the patient experiencing the symptoms, how would a chiropractor be able to tell that that joint feels abnormal for that patient? Motion palpation is another version of this, and you may have experienced this while you were sitting or lying face down on a chiropractic table and the chiropractor attempts to assess individual spinal segments. This is unreliable and no better than chance, according to Palmer College. Every chiropractor feels something different, and in research, no one can be sure if all of the chiropractors are actually on the same segment. No one can be sure if one chiropractor's definition of stiff is the same as another. So this is tricky to study. At best, research shows that chiropractors agree on the specific levels of subluxations about 50% of the time when they're relying on their hands. Another method that they use to find subluxations is checking leg length. Checking leg length is reliable in the sense that most chiropractors can look at someone lying on their stomach and then identify if one leg looks shorter than the other. But is leg length clinically relevant? Is there any validity to it? That's the question. So in other words, if someone has a leg that looks shorter, what does it actually mean? How would that affect treatment? The continuing education course didn't address this question, and I haven't seen any research providing any good quality support for identifying which level to adjust by simply looking at leg length. Manual muscle testing is another method. This is most commonly associated with a technique called applied kinesiology, and this has mixed results for reliability. According to the continuing education course on subluxations, the presenter is not too sure about using it to identify subluxations. Thermography and surface EMG are two other methods used to find subluxations. This is when a chiropractor would use an instrument to check for differences in skin temperature. It's usually like a handheld device that may be linked up to a computer. There are mixed results for reliability with this, and according to the course provided by Palmer College, evidence is unfavorable for looking at skin temperature around the spine to detect subluxations. X-rays are a very common method used by chiropractors to determine where to adjust. But again, according to the presenter from representing Palmer College, there has not been a lot of research assessing the reliability. And finally, there is the montage method. Many chiropractors use a variety of tests. Research has shown that when chiropractors use a variety of tests, they agree on the subluxation location 60 to 80% of the time. But agreeing on something is just a form of consensus, which is not science. When 60 to 80% of chiropractors form a consensus and agree on the location of a subluxation, what are the objective tests that are then used to determine if a subluxation actually exists in that location? Okay, so there's pain. But how do we know that the spine isn't moving well? And how do we know that the nervous system has been negatively impacted? And how do we know that the body's ability to self-regulate has been negatively affected? Apparently, we just need to assume all of these things because we're not measuring them. Here's an analogy. Let's say that out of a large group of people, 60 to 80% of them point to the same shiny rock, and they form a consensus that they found gold. Is that consensus enough evidence to claim that the rock is made of gold? Can they just sell the rock at a high value because most of them agree that it's made of gold? No, because we have ways to objectively test the shiny rock to see if it's actually made of gold. So let's bring this back to chiropractic. If pain is absent, then chiropractic assessments designed to locate subluxations don't seem to be very reliable. This is an important point made in the subluxation course from Palmer. And since there are no objective ways to identify a subluxation, a chiropractor would just need to assume that a subluxation exists if they poke a patient and the patient feels pain. This doesn't seem like a strong case for subluxation-based chiropractic. Also, this may not be a great sign for those who promote maintenance chiropractic adjustments when someone isn't in pain, because pain seems to be the only reliable factor for deciding where to adjust. So, based on the subluxation course that I took from Palmer College and everything that I've read, here is my current understanding of the definition of a chiropractic subluxation. Many chiropractors believe that when spinal segments are out of alignment or aren't moving well, the abnormal alignment or poor movement results in changes in the brain and the spinal cord that interfere with the body's ability to repair and heal itself. Therefore, if chiropractors adjust the spinal segments that are out of alignment or aren't moving well, they will restore proper motion or positioning, allowing the brain and the spinal cord to send signals that will promote repairing and healing of the body. Chiropractors locate subluxations by using a variety of clinical tests with questionable reliability. Using these unreliable tests, research indicates that a group of chiropractors can agree on the location to adjust about 50 to 80% of the time. Unfortunately, chiropractors have no reliable clinical tests to determine the location to adjust other than poking painful areas. Even if a group of chiropractors forms a consensus on the location to adjust, they have no reliable tests to determine if a subluxation exists in that location other than assuming that pain must mean that a joint isn't moving well and, therefore, must negatively affect the nervous system. A chiropractic adjustment is then delivered to the painful area under the assumption that a subluxation exists in that location. Even with a group of experienced chiropractors, no one can be 100% sure which specific spinal segment a chiropractor is adjusting because there are no reliable clinical methods for locating spinal segments or assessing which specific spinal segment makes the pop during the adjustment. After an adjustment is delivered in the ballpark of the consensus subluxation, chiropractors have no reliable test to determine if the subluxation has been cleared, because there was no reliable way to know if it even existed in the first place other than assuming that pain must equal a subluxation. There was a lot of assuming during this process. Now, I will admit that my assessment sounds harsh. I really tried to see the other side of this debate by reading chiropractic research and taking a course promoting subluxations from Palmer College, which was actually taught by one of the most renowned chiropractic researchers. At this point, you may be wondering a few things. Is there a body of scientific evidence demonstrating that people who receive chiropractic adjustments suffer from less pain than people who don't? And is there a body of evidence demonstrating that people who receive more chiropractic adjustments are objectively healthier than people who don't? Because according to any version of the chiropractic subluxation definition, clearing subluxations helps the body heal itself. Now, there are definitely studies that show some benefits. So when chiropractors claim to have scientific evidence, they're not lying. But when looking at research, it's important not to hyper-focus on individual studies and then ignore the larger bodies of evidence. Here's a statement from the Palmer College Continuing Education course. We currently have a little bit of high-quality evidence that has looked at chiropractic care and maintenance care, but not for anything other than low back pain. This doesn't mean that maintenance care doesn't help to optimize human potential or quality of life. It means that we don't really have any studies that have investigated it yet. However, there is good evidence to suggest that maintenance care is a good thing for patients with recurring low back pain who respond well to early care. That is a good start. We simply do not have a lot of research that investigates the effect of chiropractic care, particularly for people who don't just have low back pain, neck pain, and headaches. Well, there you go. We don't have any research suggesting that chiropractic adjustments improve health or quality of life. This course is also very honest about the fact that chiropractic adjustments don't outperform any other treatments for low back pain, which is chiropractic's bread and butter. It's important to understand that research seems to consistently suggest that no treatments are superior when dealing with chronic low back pain. With a large enough group of people, getting a back cracked will work just as well as doing nothing at all. Now, that doesn't mean that getting your back cracked for low back pain is a waste of time, but statistically, it's not superior to anything else, which is great news, actually. It means that patients and chiropractors have many options for addressing spine pain. Options are great. We always want options. So if adjusting works well for you, that's awesome. But if adjusting doesn't work well for you, or you're not interested in getting adjusted, you have other options that will probably work just as well. Chiropractic adjustments do appear to be a very good option for people suffering from headaches that are related to neck pain and neck stiffness. But again, if someone has pain and stiffness, should we just assume that their joints are affecting the central nervous system and thus degrading the body's ability to function? It still seems like a stretch to suggest that pain and stiffness represent a subluxation affecting nerve function and overall health. Here is how the American Chiropractic Association defines chiropractic. Chiropractic is a healthcare profession that focuses on disorders of the musculoskeletal system and the nervous system, and the effects of these disorders on general health. These disorders include, but are not limited to, back pain, neck pain, pain in the joints of the arms or legs, and headaches. Doctors of chiropractic practice a conservative approach to healthcare that includes patient examination, diagnosis, and treatment. DCs have broad diagnostic skills and are also trained to recommend therapeutic and rehabilitative exercises, as well as provide nutritional, lifestyle, and dietary counseling. You may notice that this definition doesn't mention anything about subluxations or clearing subluxations with chiropractic adjustments as being essential components of chiropractic care, which is interesting. So am I saying that chiropractic adjustments are useless? No way. Joint manipulation and manual therapy in general can be really valuable as adjuncts to more comprehensive treatment plans. But problems arise when we attach exaggerated narratives to adjusting and then sensationalize the potential results by misrepresenting the limited research supporting those potential results. Here's some research demonstrating clinical outcomes that are clearly relevant, in my opinion. There was a study published in 2020 that shows that patients with spine pain who saw a chiropractor had half the risk of filling an opioid prescription. So, people at risk of opioid addiction may be a specific population that could really benefit from chiropractic adjustments. I'd love to see more research in this area. It looks promising because it's already showing clinical outcomes. No one is squabbling over whether or not a subluxation exists or has been cleared. They're just looking at clinical outcomes. People with spine pain who get their backs cracked seek fewer opioids, which could result in fewer scenarios of addiction and overdose. That's an awesome clinical outcome. We need to study this more. Let's review. Subluxation philosophy and routine chiropractic adjustments justified by subluxation philosophy are not well accepted outside of the chiropractic community and are heavily debated within the profession. You may be wondering, if chiropractors weren't going to treat subluxations with routine adjustments, what would they actually do with their patients? What role could chiropractors play in healthcare? Here is the role that many chiropractors are already playing in healthcare. Chiropractors could take thorough health histories and listen to patients. They could not only listen to the main complaint, but also be curious about the patient's entire health history. Chiropractors could try to learn about who their patients are and then understand their goals. They could perform effective physical exams that include clinical tests that are known to help manage health, such as vital signs. Chiropractors could rule out scary things and address patient concerns and fears. They could narrow down the possible diagnoses and then consider other factors influencing pain, like physical activity, nutrition, sleep, mental health, expectations, perceptions, beliefs, fears, and other health issues. A chiropractor would not treat some of these factors, but identifying the signs and symptoms could encourage prompt referrals for co-management when it's in the patient's best interests. Chiropractors could explain the prognosis. So, how much better can you get and how long will it take? They could present treatment options, even referral options if appropriate. Chiropractors could explain the risks, rewards, and limitations of these treatment options. They could be healthcare providers who don't prescribe pre-packaged solutions. Once the prognosis and the treatment options are explained, chiropractors could ask their patients how they want to begin. Together, they could build a treatment plan that motivates the patient to participate in their own healthcare. Chiropractors could be honest about their roles and their abilities and their limitations. When a chiropractor is not the best person to help, they could refer or co-manage rather than adjust every patient. When a patient and a chiropractor decide to work together, the chiropractor could walk with the patient and guide them in an attempt to offer support while fostering the ability to help themselves as much as possible. Essentially, chiropractic could be a profession known to teach patients not to need chiropractors. This process would probably include education, support, lifestyle modifications, rehab, and strength and conditioning. When manual therapies like adjustments are used, a chiropractor could set realistic expectations and be honest that these therapies are only known to offer short-term relief, and they will be used to augment the larger treatment plan. If adjusting and massage are helpful, chiropractors could attempt to teach patients ways that they could achieve similar pain reduction without a clinical visit. Examples include self-mobilization, stretching, techniques for self-administered soft tissue therapy, and then movement-based pain management options. Chiropractors could use joint manipulation as a tool and stop tying their professional identity to this one specific form of therapy. Well, why does it matter? Chiropractic care is safe and affordable. Generally, people feel better after they get adjusted, so why do we care if there is strong or weak evidence to support chiropractic adjustments? And if people feel better, why does it matter which words we use to explain the effects? Subluxations, misalignments, joint dysfunction. Why does it matter what we call it? I have worked in subluxation-based clinics. These kinds of clinics do promote the theory that routine chiropractic adjustments improve health and prevent pain. And I actually don't see anything wrong with chiropractic clinics that simply adjust all of their patients and then send them on their way. I do think their patients are missing out, but if routine adjustments help people feel better, I wouldn't tell them to stop. I have issues with clinics that claim to treat chiropractic subluxations and aren't honest about the fact that their care plans are based on theories and philosophy rather than empirical evidence or clinical outcomes. My issue is with the misrepresenting of the research and the exaggeration of the potential benefits. Here's an example of why it matters. When working at chiropractic clinics, I have asked people why they think they're in pain. Many chiropractic patients believe that they're in pain because they have fallen off maintenance care plans. They believe that they need routine chiropractic care to feel normal. It makes me sad that we make people feel dependent on getting adjusted. It also matters because patients can't give informed consent if they don't understand the potential risks, rewards, and limitations of their treatment options. If treatment is 99% based on philosophy and 1% based on evidence, technically it's not wrong to call it evidence-based care. But wouldn't you want to know? I would. Now, I'm definitely not suggesting that patients should receive lectures on the complexities of pain science and the disagreements within the healthcare system and the proper management of pain. I'm not even suggesting that chiropractors necessarily change the way they practice. What I'm suggesting is that the words we use influence patient decision making. People make healthcare choices based on our recommendations. They trust us. We need to take that seriously. If a chiropractor or any other healthcare provider is going to provide therapy or recommend treatment plans supported by weak evidence or primarily based on philosophy, then that healthcare provider shouldn't make claims that they can't support with quality evidence. So, the therapy and the treatment plans can probably remain unchanged. We just need to stop trying to justify our methods by misrepresenting the strength of our supporting evidence. If we recommend maintenance care based on subluxation philosophy and then let our patients know that it may or may not be helpful, but we still believe it may benefit them, then I don't see any harm in the practice because we would be transparent. I'm not calling for chiropractors to stop adjusting people or for people to stop seeking chiropractic adjustments. I'm calling for chiropractors to stop making claims that we can't support with quality evidence. That's it. Because for the last almost 130 years, not only have we failed to support many of our subluxation theory and maintenance care claims with quality evidence, but there is an ever growing body of high quality evidence refuting these beliefs. We need to adjust our narrative and do better research. And the research should not be conducted with the goal of validating what we have historically done as chiropractors. The research should objectively test our methods, and then we should be prepared to change if the research results don't go our way. This also matters because many people are worried about being sold lengthy care plans that may result in them developing a dependence on routine chiropractic care just to feel normal. They don't trust us. This is a fear that causes many people to avoid chiropractic care, which is a shame. No one wants to feel like they're being sold unnecessary healthcare. Stereotypically, chiropractors have led people to believe that in order to obtain what they want, they must lie down on a chiropractic table and get their backs cracked routinely and continuously. I am not making a judgment here. I'm really just repeating a stereotype. If you're a chiropractor and this stereotype upsets you, good. It bothers me too, and we need to change it. It's interesting that a portion of the modern chiropractic profession still embraces old philosophies, because the profession was founded by people who wanted to change. The founders were free thinkers looking into the future for something better, and oddly enough, many current chiropractors romanticize the past by clinging to old philosophies and practices, while simultaneously idolizing the founders of chiropractic who didn't want to cling to old philosophies and practices. Well, that's all I have for you on the subject for now. I've listed all of my sources in the description. I hope this was helpful. If you don't agree, I'd love to hear your thoughts. Let's talk about it.